So diet therapy, it is concerned with modification of the normal diet to meet the requirement of a sick individual. Okay, so here uh, based on the RDA, but some certain modification just to meet the recovery requirements. Okay, it's not a remedy. It's just for a short period of time when the individual assumes their former healthy state. Okay, diet therapy will be stopped. It makes for medical or surgical treatment more effective. Okay, because food are also medicine. Food is also considered as medicine. So diet therapy is exactly medicinal science which will enhance the drugs which a person is already on. Okay, it may enhance the mechanism of action of certain drugs which a person is taking for a specific disorder. Okay, and when it comes to surgical treatment, as I told earlier, so soon after surgery, one is advised to have uh, good vitamin C rich foods, etc. Okay, to enhance the wound healing. Okay, so that's the example of diet therapy. So purpose of diet therapy to improve the nutritional status of a person, to meet their energy requirements while on recovery, to correct deficiencies if any, to give proper rest, because usually when a person is on diet therapy, they are usually not suggested hard to digest food. Okay, easy to digest food is suggested in when a person is in recovery, so that it gives adequate rest to the body. The body is not spinning round and round on the metabolism. Metabolic ability of the person will be enhanced based on the slight modifications which we have done in the diet. Some people, like for example, lactose intolerance people, they can't metabolize lactose properly. So with diet therapy, their body can get afford a rest, proper rest. Along with that, their metabolism will not be hampered. Changes in the body weight, obviously for weight management, that's the most hyped one. Weight management is the most hyped diet therapy one people go after. So with that, we'll come to the glycemic index. This is an important part, okay, glycemic index. So all the foods are, the basic principle which we apply here is all the foods are not digested or absorbed in the at the same rate or at the same time. Okay, some food will quickly rise your blood sugar level. Some food will take time to rise your blood sugar level. Okay, so the glycemic index, it suggests that it is just a ranking system. Okay, glycemic index is just a ranking system from 1 to 100. It will just rank the food. Okay, which has the highest glycemic index, which has the lowest glycemic index, like that. Okay. So this is the formula which we use for like identifying glycemic index for a specific food. Okay. Here you can see in the denominator. In the denominator, you can see reference food. Usually, this reference food is a plain white bread. Okay, 100 grams of plain white bread or 100 grams of glucose. Okay, so usually these are the reference food which we take to make a comparison. Most of the time it is a plain white bread which we use as a glycemic index to identify the glycemic index for any other food sources. So reference food remains the same for all the test. Okay, all the glycemic index test which we do, reference food remains the same. Some laboratories, they will use plain white bread, and some laboratories, they will just use glucose. Okay, so denominator, the reference test food. For example, if today you are going to do this test on various kinds of foods, okay, whatever reference food you have taken, plain white bread or 100 grams of 50 grams of glucose, okay, it should remain the same. When you're taking when you're going to test the glycemic index value for watermelon, ice cream, okay, chapatis, rice, etc., keep the denominator same. Okay, the reference food should be same while checking the glycemic index for all the other sources of food. Okay, so 50 gram of a carbohydrate reference food, usually a white bread or a glucose, is used in the denominator, and 50 gram of the test food. Okay, 50 gram of watermelon, 50 gram of ice cream, okay, 50 gram of chapati, 50 gram of rice, cooked rice, white rice, boiled rice, whatever is the test food will come on the numerator into 100. Okay, so this is the formula which we use to identify the glycemic index. So here, when you give this test food or test food to a person, okay, every 2 hours you will check their glycemic, like what is their blood glucose level. Okay, time maybe half an hour, 2 hour, okay, whatever the time you have selected. Okay, at regular intervals. Okay, you can see here so many dots are there. Okay, at regular intervals you will just plot the dots. Okay, how much is the blood sugar level you have identified and what is the time. According to that, you will plot the graph and you will just draw a curved graph without using a scale. Okay, draw a curved graph, and then you have to calculate the area under the graph. You can directly count how many cubes, graphical cubes are there under the graph, or other formula. You can use other formulas for that matter. Calculate what is the area under the graph. Okay, so this area is used in this formula. Whatever area you have found which comes under any given graph. Okay, if it is a high glycemic food, the graph will look something like the red one here. Okay, and the pink area which you see, pink area, the number of the pink area will be used in the formula here. Okay, and if it is a moderate glycemic index food, the graph will look something like this, the yellow line and the yellow area. Okay, and low glycemic index food will look like this green area. Okay, so the area which this graph covers, that is used in the formula, nothing else, only the area which the graph covers. So that is the reason why we have used incremental blood glucose area, incremental blood glucose area of 50 gram of any test food divided by incremental blood glucose area of 50 gram of reference food into 100. So that's how we calculate the glycemic index. So factors affecting glycemic response. First is the rate of digestion. Like if you sip a 50 gram of glucose slowly over a period of time, okay, the way how the glucose increases, okay, the blood glucose level increases is again very slow, because in 1 hour slowly you are just sipping a glass of 50 gram of glucose. Okay, you're obviously your stomach is receiving this glucose at a very slow rate, and corresponding to that, at a very slow rate your blood glucose level will increase. Okay, but within a minute you are gulping down a 50 gram of glucose water, you will see your blood glucose level will correspondingly spike up as soon as that. Okay, so the rate of ingestion, okay, how slowly you are ingesting your food, how slowly you are having the food, accordingly in the same way slowly your blood sugar level will rise. Okay, that's the reason why we say that don't rush your food. Okay, have be calm, cool and seated, take your time while having food, etc. The reason is your blood sugar glucose level will also spike in a very calm and slow rate. Okay, if you're having food on the go, okay, like the fast food and everything, which you have on the go while walking, etc. Okay, it means that at proportionately your blood sugar level is also spiking at a high rate, and that's how you become insulin resistant over a period of time. So the rate of ingestion uh, depends on the glycemic response. Then food components. Okay, what is the protein fat content of your food, what is how much is the complex carbohydrate content of the food. Okay, if it is simple carbohydrate content, glycemic response will be very quick. Okay, simple carbohydrates, very quickly your blood glucose level will rise. Complex carbohydrates, it will take time, because it takes time to get assimilated with the pancreatic juices, gastric juices, and then be absorbed. It will take a lot of time. Complex carbohydrate will take a lot of time. Simple carbohydrates, it will give a very quick glycemic response. The method of cooking and processing, anything deep fried, okay, too much of over processed food like baked items, cakes, etc. Okay, and any cooking method which requires over processing, deep frying, okay, that in these cases your glycemic response is very quick. But if you're steaming your food, boiling your food, just lightly sauteing your food, etc., glycemic response will be low. Then physiological effects, which one has, like if your stomach is not acidic enough, okay, if your stomach is not acidic enough, uh, undigested food will go down the pathway that will have any other ill effects. Okay, the pH level of your gastric juices, pancreatic juices should be adequate enough so that it aids in absorption. Otherwise, again, glycemic response will be delayed. So here are some classification of foods which have low, medium, and high glycemic index. Okay, so yeah, the ones which are having the low glycemic index, the food which have glycemic index with the range of 55 or less. Okay, that's the range which we use. The range will come again in the coming up slides. At that time you can notice where the high, low, and medium food lie on in that particular scale. Okay, so yeah, again, the what is the range of glycemic index, in what range we will call it as low, in what range we call it as medium, at what range we'll call it as high, that should be known. Examples are given again in the textbook. Various examples are given on page number 228, table 12.1. Okay, you can just refer that. So this is the scale I was talking about. Here you can see in the first image, this is the scale which depicts the glycemic index. So anything that is less than 55, okay, any food item which has a glycemic index less than 55 are considered as low glycemic index food. Between 55 to 69, moderate, medium glycemic index, and more than 60 or 70 and high, equal to 70 or high, is high glycemic index food. Then we will discuss now about glycemic load. Okay, so there is a drawback with when we see the glycemic index. There is a drawback that it will just show you, you will just get the result of you are having food, simultaneously your blood glucose level is increasing. That's the only idea which you get from glycemic load. But the quality of food, the quantity of food, okay, which will keep your blood glucose level high for a long period of time, or the quality and the quantity of the food which will bring down your blood glucose level after a period of time, that kind of information you will not get from glycemic index. Okay, to get that information you have to go to glycemic load, which is much more accurate. Okay, the information that glycemic load gives is much more accurate. Okay, because glycemic in glycemic index, if you remember the formula, okay, we are only depending on that particular 50 gram of food, okay, and the response of this 50 gram of food. Nobody is considering, like, nobody has 50 gram of glucose and call it a day, or call it a meal. Okay, nobody will have just 50 gram of bread, 50 gram of watermelon, and say, okay, I'm done, my lunch is done. Nobody does that. Okay, this 50 gram of reference food, 50 gram of test food is used only to identify how this particular form of food will increase your blood glucose level. That's the only thing, nothing more. But the amount of the quantity of food, if it is more than 50 gram, for example, you are having 200 gram of watermelon, what kind of what kind of response your will be the blood glucose level, what will be the blood glucose level, glycemic index cannot tell you, but glycemic load can tell you, because it takes into consideration exactly the number of carbohydrates in gram was present in your entire meal. In your entire meal, how much carbohydrate was present. For example, you are having dal, chapati, fruits, some sabzis, everything. Okay, there is a carbohydrate level in the amount of dal which you had in one katori dal. How much carbohydrate you had? There is an amount for that. One ball of rice, how much carbohydrate it is there. Two chapatis, how much carbohydrates is there. Sabzis and fruit ball, etc. How much carbohydrate was present, especially in the exact portion which you had. You will get that information. Put that information in this formula. Okay, you will get your glycemic load. So glycemic load is much more accurate. It is much more based on reality. Okay, glycemic index is just used to rank the food, just to identify which food will give high glycemic index. The people suffering from diabetes should avoid that. Okay, like that information you will find. But exactly the entire meal which you had just now, what was the impact of this meal on your blood glucose level? Only glycemic load can give you that idea. So that's the difference. Okay, is that clear to all? Is that clear to all? Please reply in the chat box the difference between glycemic load and glycemic index. Okay, so again, you can read the same statements here. Glycemic index. Glycemic index ranks carbohydrates based on their immediate blood glucose response. How much carbohydrates? Only 50 gram. Okay, only 50 gram of carbohydrates we take into consideration while while checking glycemic index. But what if the person has more than 50 gram? What was the exact portion size of what they had, the meal they had? Then you have to come to glycemic load. It helps predict the blood glucose response to a specific amount of specific carbohydrate food. Specific amount means, let's say, 250 gram of watermelon. 250 gram of watermelon, that is a specific amount. And specific carbohydrate food, watermelon is a carbohydrate food. Okay, so specific amount, how much gram of what kind of food you had. Okay, it gives the idea of the quality of the food and the quantity of the food which increased your blood glucose level. Okay, so yeah, glycemic load. While calculating glycemic load, obviously you require glycemic index, because check the formula here. See the formula of glycemic load. To identify glycemic load, in the formula itself there is glycemic index. Means what? Glycemic load is dependent on the information glycemic index gives. We do require glycemic index ka information to identify. uh, for example, let's say we'll do a small practical here. Okay, so you can go to your page number. Yeah, go to page number 228. Go to page number 228. See what is the glycemic index of watermelon. See what is the index of like watermelon. 76. Keep that 76 number aside, and just let's say you had 300 grams. You had a bowl of watermelon. It was around 300 grams. You just had a 300 grams of watermelon. Okay, so 300 into 76 divided by 100. Can you give me what is the answer to it? Please do a calculation here. The exact sorry, also find carbohydrates in 300 gram of watermelon. Please Google it. Anyone, please Google carbohydrates in 300 gram of watermelon. Yeah, around 24, 22 or 24 gram. Okay, so this 24 gram, yeah, it is around 24 or 22 gram of carbohydrates in a 300 gram of watermelon. So take this 22 grams into 76, the glycemic index which we already know, divided by 100. What is the answer which you find here? Yeah, it is 16.72. Okay, so the glycemic load of watermelon, okay, glycemic load of watermelon is 16.72. If it is 24, if it was 24 gram, obviously the answer will be slightly different. Yeah, if it is 24, it was 18, and if it was 22, it was 16.2. Still, look at this glycemic load scale which is given here in the bottom image, which you can see here in the bottom image. Where do you put this 18 or 16? Is it low, moderate, or high? It comes under moderate. Okay, so glycemic load says that watermelon has a moderate glycemic load. It is not that harmful. But if you see, 76 was the glycemic index of watermelon. And what do you call that? Was it low, moderate, or high glycemic index of watermelon? Glycemic index. Glycemic index will say watermelon has high, it is high, it is bad. Theoretically, it will say theoretically high glycemic index foods are bad for your health. Okay, so theoretically, watermelon is bad according to glycemic index. But again, theoretically, when we did the glycemic load, it is moderate. So understood the difference. So in glycemic index, you will only know the information from 50 gram of any given food, not more than that. But glycemic load, in glycemic load, you will get the information about the exact portion which you had. For example, if you had only 200 gram of, let's say you just had 200 gram of watermelon, and when you do the glycemic load, you will see it will not be moderate, it will come under low. You will see the because the quantity and the quality, that plus or minus is standard deviation. Okay, in some forms of watermelons, in some tests they found that it was around 78, in some tests they found that it was 74. Okay, so the average is around 76. It can go plus or minus here and there depending on what kind of test they did to identify glycemic index. Okay, for calculation you can use this formula. In book it is slightly different. For exam, just follow what is used in the book, but practically we usually use the glycemic load formula as the one which is given here. So I guess now the calculation part is clear. Okay, what is the use of glycemic index? Obviously we require glycemic index. Without glycemic index you can't find glycemic load, but glycemic load gives you a much better reality based accurate information about the things that are good for you or bad for you. So obviously to identify which kind of food is good, just to bring down your blood glucose level, go for food which you has a low to moderate glycemic load. Okay, next, dietary supplements. The types of dietary supplements we usually get here is herbal, bodybuilding products, laxity supplements, biological and nutritional supplements like the Amway, Herbalife, etc. So these are the different types of dietary supplements which we have, and depending on one's requirement, only for depending on only on one's requirement, dietary supplements should be considered. Otherwise, try to get all your nutritional requirement met via your diet. If the diet is inadequate or because of any other underlying conditions, you have consulted, you have been diagnosed with certain conditions which requires dietary supplements, only then you go for this. Okay. There are various pros and cons about dietary supplements, but for that we have to discuss the another chapter called nutritional supplements. When we'll discuss that, we'll discuss about this in detail. Okay, but these are the different types of dietary supplements usually which is available in market. Okay, like clean dietary supplements, like the ones we call it as herbal, without any synthetic formulations. Okay, bodybuilding products, laxative supplements, biological nutritional supplements like Amway, Herbalife are the examples of biological and nutritional supplements. So diet and inflammation. At any given point of the time, if you come across a obese person's blood report or morbidly obese person's report, you'll always find the WBC levels, leukocyte count. Okay, leukocyte count will always be on the higher side because there is an innate inflammatory response which the body is going through 24/7. When one is obese, okay, not overweight, but when one is obese, an innate inflammatory response will be going through throughout the body. The body will be in a stage of 24/7 inflammatory stage. Okay, so with respect to that, you will see the leukocyte count, the WBC count, white blood cells count of a morbidly obese person is quite high. Okay, the reason is they have a low grade systemic inflammation which they are going through. It may not come on surface with regard to other signs and symptoms, but at systemic level, if you do the blood serum analysis, you will find inflammation. So to contract that, these are the different types of anti-inflammatory food which we can have. The same table is given on page number 232. You can refer to that if the slide is not visible. Okay, it may be too small for you. Please refer. Yeah, high means above normal levels for what? Glycemic load index, like I don't know what question is this in sense of glycemic load or glycemic index. Please elaborate your question. Yeah, these are the different types of anti-inflammatory food which one can have. Yeah, WBC count, obviously. The WBC count will be high, means when the body goes into the state of inflammation, okay, your leukocyte counts are high. Okay, because the leukocytes site counts are high, your body is in the stage of inflammation. Okay, it's going to tackle the infection or it is going to do the phagocytosis, etc. Okay, to bring down the inflammation. That's one response. So when you see on a like you do not have any infection, the person does not have any infection, and they do not have allergies also. Okay, because in some cases the eosinophils will be high. It means that you were suffering from allergic reaction. But apart from the eosinophils, basophils, neutrophils, other leukocyte counts are high. It means that the body is in a stage of inflammation. So that's when you have to incorporate these anti-inflammatory food. Okay, this is much clearly given in your textbook. Please read that. Okay, some points are also given. Just read through that. It's a self-study subject. Okay, the same table, the pyramid chart which I have used here is used in the page on page number 232. Please refer that for anti-inflammatory food. Then we have prebiotics, probiotics, and symbiotics. Okay, prebiotic is the food for the good bacteria which is there in your gut. Okay, prebiotics is the food for your gut bacteria. For example, bananas, etc. Okay, these gut bacteria are not harmful for us. They are required. They are required for the metabolism and digestion of various food. So prebiotics are the food which you give to your gut bacteria. Okay, probiotics are live bacteria which you ingest because your gut may not be producing enough bacteria. Your gut is a hostile environment for this good bacteria to survive. In that cases, you may go for probacterial food like yogurt. You get in market also you get various Yakult and all. Okay, probiotic drinks which you can ingest in a curd or anything that does not have lactose but it has lactobacillus, like buttermilk, curd, yogurt. Okay, So these are the examples of probiotics. Synbiotics are available in the market. It's a synthetic form of prebiotics as well as probiotic. It's a mixture of the food for your gut bacteria as well as some gut bacteria. Okay, that is called synbiotics. Some examples of synbiotics are given on page number 234. Bifidobacteria, lactobacilli, the combination of bifidobacteria and lactobacilli, fructooligosaccharides, FOS, and bifidobacteria. Different combinations are given on the textbook in a paragraph. You can refer that. So these are the examples of prebiotics as well as probiotics. Food for probiotics: asparagus, wheat bran, flour, garlic, bananas. Probiotics in the form of live bacteria: yogurt, probiotic milk, sour cream, kefir. Then artificial sweeteners. So the caloric value of the artificial sweeteners is much lower than the sugar. Okay. Not all fibers, only some form of fibers help, like try being the prebiotics, not all fibers. Okay. Yeah. Polyols, sugar or alcohols, they are low caloric. Then we have non-caloric like aspartame, acyl sulfame K, and then natural non-caloric stevia. Okay, we call it as meaty tulsi. So these are the different types of artificial sweeteners which we get from the market. One has some calories, but it is on the lower side, that is polyols. Then we have 0 calorie artificial sweeteners, that is aspartame, acyl sulfame K, etc. And then natural sweetener, artificial sweetener, that is stevia. So again, when you want to choose like which is the best one to go forward with, like in the textbook it is given, always use a mixture of artificial sweeteners. That is the best way forward. Like if you are dependent only on stevia, okay, yeah, diabetic people can use stevia as a sugar replacement. It can be used. So those who are not diabetic, but if you are on a weight watch, or you want to look out for the blood glucose levels, you want to keep it down, you can use a mixture of artificial sweeteners. Or if you are someone who enjoys the taste of sugar, but you do not like the after taste of some artificial sweeteners which you have used, you can use like if you are using 1 teaspoon of sugar in your 1 cup of tea, okay, cut that sugar to half. Okay, just use half a teaspoon of sugar and half teaspoon, equivalent of half teaspoon of any artificial sweeteners. So you will get the benefit of the taste of sugar, and then you can also get the benefit of low calorie and low blood sugar levels from the artificial sweeteners. Okay, so using a variety of different sweeteners in a diet is a much better way to move forward if you are non-diabetic. Okay, if sugar doesn't harm you but you enjoy the taste of sugar, that's the way forward to go with. But if you want to completely get rid of sugar but taste is a factor here, taper down. Okay, taper down your sugar intake. Like today you are using 1 teaspoon of sugar in your coffee. By tomorrow just cut it down to 1.1 of the teaspoon, slowly then half teaspoon, 3/4 of the teaspoon, like that. Taper down your sugar intake and slowly add artificial sweeteners, so that you get accustomed to the taste of artificial sweeteners, because mostly the taste of artificial sweeteners are the one thing that puts people off the grid. So that's the one thing which you can go forward. Obviously mixing some amount of sugar for that taste, and depending on the artificial sweeteners for the sweetness part of it. Okay, it is the way forward. If you are not diabetic, sugar doesn't affect you, you can definitely go forward with that. And the a good limit which the WHO has suggested is 25 gram of sugar per day. Okay, 25 gram of sugar per day is a very good amount to keep in check. Okay, not more than that, but 20, at least 25 gram of sugar per day will do you no harm. But if you're diabetic, not for diabetics, for other healthy people, I'm referring this particular gram. Okay. Yeah, white sugar 25 gram on a daily basis will not do any harm. Stevia is it's like, see, stevia is around 300 times sweeter than sucrose. Okay, so and it does not have uh, that kind of blood glucose level spike what the sugar will give you. Okay, so the people who are like, say, 25 gram of sugar for an average person, okay, average person who already has a pretty good health, who is free of any deficiency diseases, who is not on a weight management or a calorie counting uh, thing which is going on. Okay, those people, it won't affect. Okay, this is for a healthy individual, free from deficiencies, free from any other infirmities. 25 gram of sugar is given by the WHO. Otherwise, you can just translate that as 4 to 5 teaspoons of sugar per day. Okay, it won't create any harm on you. Okay. Yeah, stevia is completely fine for weight management. Stevia drops or stevia powder and dry stevia leaves are also available. Okay, dry stevia leaves is available. If you are on weight management, you want to completely get rid of sugar just for personal preferences, you can switch it with stevia. It is completely fine. Stevia is the most natural form of sugar replacement. So next, food and drug interactions. From page number 270, uh, 237, 230 onwards up till 241 and 243. Okay, up till 243, there are various tables which will give you adequate information about various food, nutrition, and drug interaction. Some nutrients do hamper the drug mechanism of action of certain drugs, and which food, which drug, or which kind of nutrient affects the drug interaction and which kind of drug it affects, it is given, all the information is given on the tables. Okay, don't read the entire thing. If you are free, you can read, but if you just want the information, if you just are looking for the information, from page number 237 to 243, there are various tables. Please refer the tables, you will get adequate information. If you are taking any drugs which are listed in these tables, just read about it. Okay, which kind of nutrition or which kind of appetite you have to look out for or avoid or include to get the best benefit out of the drug which you're taking. Okay, so these are the tables I will be mentioning the tables, which please just go through this. Table 12.5, effect of food on absorption of drugs, how the food affects the drug absorption. 12.6, effect of various foods and beverages on drug action. Table 12.7, examples of drug nutrient interactions. And 12.8, effects of drugs on food intake and absorption. These are the tables, main tables, which will give you adequate information to know how the drug and the food interacts. You may be taking some of the drugs which are listed here, or your family members may be on it, so you can give them proper guidance accordingly. So next we have personalized nutrition, nutrigenetics, and nutrigenomics. An entire chapter is there on this. We'll take it in detail. Just to give you a brief, nutrigenetics means everyone is different. Okay, nutrigenetics, everyone is different. Your DNA plays a role in how it is going to metabolize the food. That kind of information we will get from nutrigenetics. Okay, genetics, your genetics. Okay, and then we have nutrigenomics, how the nutrient which you have, okay, inhale when you eat, ingest, or the substances you are around, okay, nutritional substances you are around in. So how this will affect your genome. Genome is your entire DNA structure. Okay, so that is nutrigenomics. How the food affects a person's genome. Okay, you may be born healthy, but you may be ingesting certain kind of food which may be causing some genetic mutations. Okay, so that's nutrigenomics. Your genome is affected. That is nutrigenomics. What you eat affects how your genes behave. Nutrigenetics is personal, is much more it has a much more personal effect. Everyone is different. Everyone has a different genetic um, system in them, and their genes will determine how it will respond to various forms of food. That is nutrigenetics and nutrigenomics. There is an entire chapter about nutritional genetics. We'll discuss on that. The explanations and all the detailed explanations on this we'll discuss on that chapter. Okay.